maybe, then to a yes, and then she learned to do it at home.
Another type of refusal is when the person won't sit down. Again, think about why this is happening. If they're in the middle stage of dementia, they may not understand what you're asking. If the person is agitated or anxious, you may want to come back when they're more calm and already sitting. On the other hand, there are some strategies to encourage a person with dementia to take a seat. Try putting a chair right behind their legs, saying, "Please sit down." At the same time, pull a chair up for yourself and sit down, demonstrating the behavior. If the person continues to walk around or stand, you can still provide care. First, get the person's attention. Face them, look them in the eye, say their name, and talk with them. Once you've made a connection, you may be able to provide care standing up. There's nothing wrong with that. After all, most of us brush our own teeth standing up. You may even want to provide care in front of the bathroom sink and mirror, again, modeling a behavior that may be familiar from the past. Another common challenge is people who don't object when you ask if you can do mouth care, but who won't actually open their mouth. When this happens, it's sometimes because they don't understand you. At other times, it's because they really don't want you to brush their teeth. We'll talk about what to do in both of these situations, beginning with those who don't seem to understand what you want them to do. Let's start by looking at a video of one such person.
Open mouth for me. Ms. Gregory. Thank you.
Let's look at another example.
Go ahead, open it. Go ahead, open it. Open it for me. Okay, I'm going to help you, okay? All right. Thank you. Just relax. Don't tense up. Just relax, sweetie.
Did you notice how the aide touched the mouth with a toothbrush? She did that because touching the cheek, mouth, or lower jaw will sometimes suggest to the person that they open their mouth. This behavior can also be brought on by something familiar coming toward the mouth, such as a spoonful of food, or in this case, a toothbrush. At other times, it takes touching the mouth or lower jaw to help get the mouth to open. When the man still wouldn't open his mouth, the aide tried sliding the brush in, because once brushing begins, the person may let you continue. This type of strategy is often necessary in the late stage of dementia. Another activity some care providers find helpful is to invite the person to sing a song, which obviously gets them to open their mouth. As the person sings, you can sing along with them, making the experience even more enjoyable. Watch this.
Oh yes, take me back. Yes.
So you now have several options for encouraging people who didn't understand your request to open their mouth. Touch the mouth or lower jaw, slowly approach the mouth with the toothbrush, gently slide the brush in, or sing. You can even try all four. At other times, the situation may be different, and the person may have understood your request, but won't open their mouth because they really don't want their teeth brushed. Treat this the same way you would approach someone who told you they didn't want mouth care. Be patient, engage in small talk, and provide a reason for mouth care, such as, "Let me get the food out from between your teeth so you're more comfortable." You can also ask if they want to do it themselves to promote independence and control. If all else fails, tell them you'll come back later and leave with a smile. So, as you've seen, it can take some effort to encourage someone to open their mouth, but if you keep trying different approaches, something will almost always work. The good news is that once the mouth is open, the person often keeps it open, and you can complete their mouth care. Not always, however. Some people open their mouth at first, then close it after you begin. This is why you should always keep your fingers on the outside of the teeth. If the person has closed their mouth on the toothbrush, have a rubber-handled toothbrush ready and use it to prop their mouth open, like this. Doing this will provide you with access to the inside teeth, and often as you work, they may open their mouth again. Just be careful not to hurt the person or to let yourself get hurt. Finally, even if the person won't open their mouth, all is not lost because you may still be able to brush the outside of the teeth. Do this by gently holding open the lips with your fingers. Another challenge is when the person grabs you or the toothbrush. This behavior is most common in the middle stage of dementia. When this happens, the first thing to do is to stop what you're doing and try to figure out why the person is grabbing. As we've said, the person may not understand what's happening, so you should first try to be sure that they do understand. Another common reason for grabbing is pain. This is usually easy to determine, like in this video.
Open mouth. Let me see again, buddy. I know. It's okay. It's okay. It's okay. It's okay.
If you see bleeding gums or sore spots in the mouth, be gentle in those areas. Talk the person through the care process and provide care as gently as you can. If you need to, slow down and stop if necessary. But please don't give up. With regular brushing, the gums really will get healthier and stop bleeding and hurting, and you may avoid a major infection in the future. If grabbing the brush is the way a person is saying that they want to do it themselves, hand them the brush and invite them to brush their teeth. Once the person starts brushing, you can use a hand-over-hand technique to provide guidance. This means placing your hand over the person's hand and helping them move the brush in the jiggle sweep motion. Here's an example.
Open your hand up. Now, brush your teeth. Brush your teeth. You know how to do it. Go back in. Go back in. Let's do it the right way. Go back. Yeah. Come on.
Another reason for grabbing is if the person is anxious or scared. If you think that might be happening, provide reassurance and ask the person if she'd like to hold your hand.
All right, Miss Mac. Mom, let me see. Mom, you can hold my hand. Mom. Hey, yeah. I'm getting the inside of your mouth, okay? Hey, yeah. Let me see. Yeah, see? You okay?
If the woman had continued to grab, the caregiver could have tried to redirect her, getting her to focus her attention on something else. Ways to do that include talking, singing, or playing music, or providing a favorite drink. Pausing mouth care to gently touch or massage someone's neck or shoulders can also work. Keep in mind that there is no one right answer when grabbing or any other behavior occurs. Every person is different, so what one person is expressing might not be what another is expressing, and what works for one person might not work for another. This is why knowing the person and having a relationship with them is so important. Sometimes a person will stop grabbing if you give them something to hold or touch. Here we tried a cup.
Thank you.
We also tried a teddy bear. You might have other ideas about familiar objects that the person may want to hold based on what you know about her. You can also try playing music that the person likes, which may calm them. Or you could try gentle touch. Try rubbing their shoulders or arm and speaking softly to calm them. The bottom line is, if someone grabs you when you're providing mouth care, figure out why that's happening and what might help them feel more comfortable. Worse than grabbing, there may be instances when people become so upset that they try to hit you. You don't want to force care or put yourself in danger, so as soon as you see signs of someone being upset, stop and try to figure out what's going on. If you stop and change your approach at the earliest sign of agitation, most people won't get to the point of actually hitting. Still, in the middle stage of dementia, some people are unpredictable and hitting may come as a surprise. If someone does try to hit you, redirecting will often work. If you don't feel in danger, try one of the techniques we described in the last section. But if the attempts to hit continue, stop what you're doing and come back later. Next, let's talk about people who have trouble spitting or swallowing. We see this in late-stage dementia and in some persons who've had strokes. It happens when brain damage affects the ability to coordinate the mouth and throat muscles. Trouble swallowing and spitting is why we recommend using a small amount of antimicrobial rinse, water, or other liquid instead of toothpaste. That way, there's very little to spit or swallow, and these liquids are much safer than toothpaste if a little goes down the wrong way. Still, just brushing the teeth can lead to some extra saliva in the mouth, and you may want to help the person get it out. Sometimes, having the person tilt forward and putting a cup under their mouth is all you need to do to suggest that they spit. The one thing not to do is to encourage someone to swish their mouth out with water if they're unable to safely spit or swallow, because all that will do is increase the amount of liquid in the mouth. General techniques to remember for people who have trouble spitting or swallowing and to minimize aspiration, meaning inhaling the liquid, is to use the least amount of product necessary and provide care sitting up. Another technique is to use a gauze pad to dab excess liquid out of the mouth. Here's a different type of spitting problem. As you watch the video, think about what's happening and why. At first, we thought this man was being uncooperative, but when we stepped back and thought about it, we realized that he associated a cup with drinking, not spitting. He didn't understand our directions. What he knew was that a cup was in front of him, but he needed to spit, not drink. He actually responded in a very reasonable way. The solution was to provide mouth care near a sink, because he associated a sink with spitting. With time and patience, you'll have similar success figuring out what works for each person. Another common behavior, particularly in middle and late dementia, is biting the brush or your finger if it's in the person's mouth. For people with dementia, biting down on what's in the mouth is probably a reflex, not something done on purpose. When something's in their mouth, they start to chew. So it's natural that they respond to the toothbrush or your finger as though it's food. Therefore, always be careful if you need to put any part of your hand in someone's mouth. Keep your fingers against the inside of the cheek so you can be bitten. You also don't want the person to bite down on a cotton swab. This could be dangerous if the swab breaks because it might be swallowed. It also could be dangerous for you as you try to retrieve the swab. If the person bites the toothbrush or swab, there are several ways to get them to let go. First, try gently wiggling the brush or swab and ask the person to open her mouth. If that doesn't work, have a smaller brush ready and use it to work around the brush that's being bitten. Sometimes this will cause the person to open her mouth. If the person still clamps down on the brush, try gently rubbing the cheek, massaging in front of the ear where the jaw joint is.
How you doing, Abner? Come on.
This often causes the person to relax the jaw muscle. If you feel safe, you can also slide your finger along the inside of the cheek and massage the jaw more directly.
Mama's bed. Thank you.
A similar behavior you may encounter is the person sucking on the toothbrush. This may happen because the sensation of sucking is pleasant. More commonly, it's because in late dementia, sucking is an instinctive reflex. Whatever the cause, you can use the same strategies to remove the toothbrush as you use for biting. More common than sucking on the toothbrush is having your fingers sucked on when you're cleaning the gums, cheek, and tongue with gauze. If this happens, stop and think why it's happening. Is it because they think it's food? Because it's painful or bothering them? Or is it just a reflex? Here are some suggestions to address sucking. If the person thinks it's food, explain in simple terms what's in their mouth and what you're doing. If it's painful or uncomfortable, be gentle, recognize the pain, and assure them you'll finish quickly. If it's a reflex, back off and start again. You may also want to redirect the person using the strategies we presented earlier. We've now discussed all of the primary behavioral challenges that may accompany mouth care provided to persons with dementia. The key is to understand that these challenges are actually a form of communication. What we haven't yet discussed, though, are the challenges related specifically to denture care. The first step in dementia care is to get the denture out of the mouth. If the person can do it themselves, by all means, let them. Let's see how one care aide does it.
You want to take the dentures out for me?
Yeah.
Okay, well, take them out so I can clean them and then give you some pancakes. Go to the side if you can't get them through the front. Getting them? Go around to the other side. You can't get them that side. Hold them on out for me, Miss Ellis. I can clean them out for you. You want me to do it?
No.
Well, okay, well, you take them out so I can clean them for you. And get you some pancakes. Miss Ella, take your teeth out so I can clean them and give you some pancakes. Hold them on down for me.
Did you see how the care aide gave verbal prompts and showed great patience, allowing the person to take her own dentures out? This is ideal and often will avoid a battle.
Can you get them? All right. Put them in the cup right here. Thank you.
At times, the person may not be cooperative or even open their mouth, though.
Okay. You ready? Yeah. Open mouth for me. Open mouth for me, Miss Lily. Open mouth for Miss Lily. Wait.
As always, try to figure out what's keeping the person from opening their mouth. Sometimes, if the person has early dementia, they'll tell you they don't want to do it. If that happens, you might be able to persuade them with a reason such as, a clean denture feels better, or your mouth will feel and smell better. Or you might ask when would be a better time and come back then. For people with more advanced dementia, you can use some of the techniques we've already talked about. If you suspect the person doesn't understand your instructions, explain in simple words and give them time to understand. For example, you could say, your teeth need cleaning. I'm here to take them out. Please open your mouth. You might also try gently touching the mouth or rubbing the cheek to prompt them to open. As always, by knowing the person and what he or she likes, you increase your chances of success. Here's the same woman who resisted denture care who is now singing along as her gums are cleaned after her denture was removed.
Mouth sang Amazing Grace for me. Yeah. Sweet the sound that saved the rest like me. Sing it for me. I once was lost, but now I'm found. Was blind, but now I see. Oh, Mouth, thank you. You're doing real good. Sing Amazing Grace for me.
After cleaning the person's mouth and denture, you'll need to put the denture back in. This can also be difficult. Again, the person has to open their mouth and you need to be sure the denture is snug and comfortable. Sometimes it doesn't fit quite right at first and you have to adjust it.
You're going to put your teeth in the pack bag. Open up for me. Feel look through the bottom, okay? See? You see how they click? So what, we might need to put some Fixodent on? They're not in, Mom. They won't stay in.
Of course, it's best to have the person do it themselves if they can, which may be reasonable for people with early or mid-stage dementia. If you're not sure whether they have the skills to do this independently, encourage them to try and help them if they're having trouble. If you do need to provide help, practice good dementia care and first tell the person what you're about to do. Then use the techniques we've discussed to help them open their mouth, such as touching the lip with the denture. With patience, flexibility, and good humor, you'll usually find a way. We're coming to the end of this module. Before we close, let's take a few moments to review the main points. Above all, your approach needs to be individualized. What works for one person may not work for another. If you encounter someone with a challenge we haven't addressed, be a detective and figure out what's causing the behavior and what's being communicated. Once you've done that, you can figure out how best to address it so you can provide good mouth care. Here are some key points to remember. If you don't already, get to know the person. Find out what he or she likes so you can provide or talk about those things. Always approach from the front. If you scare the person, you're going to have a harder time providing care. Before beginning, ask permission to provide care. Focus on the person rather than the task. As you provide care, listen for clues of the person's needs. If the person can help with their mouth care, encourage them to do so. Give simple, step-by-step directions to guide them. They'll feel more in control and your job will be easier. Explain each step before doing it. Be patient and repeat yourself if you need to. Give positive feedback and encouragement while you provide care. The more you provide gentle touch and reassurance, the easier it will be for everyone. Finally, establish a routine with the same caregiver who will care for the person every day. Once they know you, and their mouth starts to feel better, they'll quite likely look forward to your visits and to receiving mouth care. This will make your job easier and more satisfying.
They smile and say, "Oh, I was waiting for you. I was wondering if you were going to be here." And they're actually happy to see you. And they feel good after they've had their mouth done.
Boy, my teeth feel good.
We know this is challenging work, but it's rewarding.